Hello, I'm Dr. Cheryl Lee. I'm the medical consultant and eye surgeon at my clinic, the Eyeclinic by Dr. Cheryl Lee. When would we start testing? For me, if you ask me, and this is very personal because it's what I've done for my own child, I've started him ever since he was able to read letters, numbers, and I guess I was fortunate because at 3.5, he could read letters. So I've checked him every 4 months since he was 3.5 years old. Most of the patients in clinic, I'd say they start at about age 4 and they come by to see me every 6 months. I would say from my experience that most of the parents would never have guessed that the child can't see clearly, and for sure the child would not complain. So oftentimes, if we're lucky, the parents might say, oh, he's walking quite close to the TV. That's different from before. But most of the time, we'd have to have a proper check. I would say the minute a child is diagnosed with myopia, it should be treated. It's very much like I said before, the eyeball, it grows longer and longer. And that explains why the myopia gets worse and worse. It's linked with the length of the eyeball. So in other words, when myopia is diagnosed, it can only get worse because the eyeball is going to get longer if we do nothing about it. So we should address it the minute it is diagnosed. It's not all doom and gloom. There is hope. Myopia can be controlled, and you have a wide range of options. You could have myopia control glasses, atropine eye drops. There could be special contact lenses that are dual focus, daily disposable contact lenses called MySight. There's also a night contact lens called Ortho-K. And above it all, we do need to add on proper lifestyle habits. Well, the likelihood that it's due to genetics, of course it's there, but it's not very high. At best, 20%. There have been instances when parents have perfect eyesight, but their children have poor eyesight. So we would have to look at other causes for why their eyesight is poor. We can hardly blame it on entirely the genetics if we find that the child is on devices half the time and not spending time outdoors. I would say go outside, play in the sunshine, 2 hours a day. It is so important. The other thing is to minimize near work. So what is near work? So if we stretch our hand out, anything that's between the hand and the eye, that I consider as near. So that could be not just devices. It could be playing with Lego, toy cars, puzzles. So what is important, I think, or rather difficult for the parents, is to find the child things to do that doesn't involve near work. Yeah, I think it's very much the flavor of the year to say COVID, to use the word COVID, because myopia is very much like that. It's a pandemic. Myopia is going up everywhere in the world. It's growing much quicker in Asia, but it's growing all the same, whether we're in America, whether we're in Europe. It's a pandemic. And then you'd say, is it an endemic? The answer is yes, because I cannot promise that we will not have myopia. But what we're trying to do here is to control the prescription your child has. In other words, the level of myopia. We need to keep it as low as possible. You're much better off having a child with a myopia of, say, 100 degrees than one with a myopia of 600 degrees. So yes, it is here to stay, But our work is to make sure that we keep it as low as possible.